Alright, so for this assessment, we're gonna be doing a head to toe assessment, so basically, I'll just start at your head, work your way down to your toes, and then I'll explain what I'm doing as we move forward with each step. This assessment is lengthy, so it is nice to kind of have a little piece of paper so you can write down everything on you. This is what mine looks like, but you can get some that have detailed like assessment, like checklists on it, and it just helps you not forget what you're hearing and what you're seeing, since you are assessing so much and you have to do it with both sides bilaterally. So let me get my gloves on. So we'll just start at your head, and I'm just gonna be feeling for any like soft spots, making sure everything feels symmetrical throughout. Looking at the hair loss, or the hair, making sure there's no loss or any signs of alopecia there. Feeling the temporal arteries, making sure they feel soft. Just palpating all around the neck for any lymph nodes, the trachea. Palpating the sinuses for any pressure here. The temporal mandibular joint, you press, your jaw stays closed, which is good. I'll have you scoot back a little bit, and I'll take a look in your eyes and your ears really quickly. And then we're just going to be testing the pupils, and then we'll look inside the eye as well. We're just checking to make sure that they dilate properly. Alright, I'm gonna have you look down. Open your eye for me. I'm gonna pull this, open.
Sorry.
Yeah, you're okay. We're just making sure the eyes look white, the insides look good, it's not yellow, nothing's dry in there. Okay, I'm gonna have you follow my finger one at a time. This way. Outside, in there, looking inside, no drainage or any clear drainage, which would be spinal fluid. Look here, again, just looking for redness, any signs of drainage. Look inside really quickly. Stick out your tongue, say stick it all the way down. Alright, and then back here, you're just looking for redness, swollen tonsils. She doesn't have any, so that's important to note. Lift your tongue up, please. And just looking back, making sure everything looks good in here. Okay, and then we'll assess your face. I'll have you smile. And then we're just looking to make sure everything's equal here. Close your eyes for me, okay? I'll have you tilt your head to each side, okay? And then I'll have you shrug your shoulders up and down. Good. This is gonna test your hearing really quickly, so I'm gonna hit it off here and then hold it up to each side and then let me know. Okay. Really quickly. We did the sinuses. Take a breath in with this one. Okay, we're just assessing patency there. Good. You want to note like any deviations here. You shouldn't see anything outside or any foreign objects inside, which is good. All right. I'm gonna look at your thyroid back here.
Okay.
So we just find the trachea. Here. we're feeling for lymph nodes, no swelling here. Swell okay? Good. Everything looks good here. Alright, now we're going to do the chest and lungs. So we'll listen to both sides of your lungs bilaterally and comparing. We'll do this with the front and the back side. You want to listen to 1 or 2 full breaths all the way through inspiration and exhale with the diaphragm. Turn around, please. And then the whole time you're just doing this zigzag pattern, moving back and forth, listening to each lung sound. Deep breath. Good. Sometimes lung sounds can be a little bit difficult to hear, so if you can't hear, just have your patient try to take a deeper breath so that way you can really hear it through when they're inhaling and exhaling, because lung sounds are very important. Next, we'll do the chest sounds and just look at the chest. So we want to make sure it's looking symmetrical. There's no barrel chest there. No flail chest going on. And then with the lung sound, or I'm sorry, with the hearts, we'll listen all the way through with the bell and the diaphragm, and with the valves as well. So with the valves, you can use abdomen, aortic, pulmonic, Erb's point, tricuspid, and then mitral. And then when you get to mitral, you can listen for a full minute, because that's where your apical pulses as well. And then the whole time we're just listening. When we listen to the valves, we're listening for blood flow, any murmurs, regurgitation, anything like that. So the diaphragm can help hear the louder ones while the valve picks up the smaller ones that you can hear. Okay, and then we'll go to the back really quick. We're just feeling her spine all the way through, making sure it feels in alignment. There's no curves anywhere. I'll have you take a big deep breath for me. Okay. So when you do this, you can just make sure it's rising and falling equally. Okay. And then to test tactile firmness, you take the ulnar side of your hand and then you put it in between your scapula, and then I'll have you repeat the word 99 a couple times.
99. 99.
Okay. One more time.
99.
Okay, and then when you do this, you're just checking so you can feel the vibration coming out equally. And again, it's important to do both sides of the lungs and the heart because we're comparing. We'll go ahead, I'll just take a look at your arms after this. One more thing with the neck, I'm just gonna feel carotid. This is really quickly. When you're feeling carotid, you don't wanna press too hard and you wanna do one at a time. And then you want to look for jugular vein distension, which she does not have any. We'll go ahead and look at your arm. So when you're doing a skin assessment on the upper extremities, you just want to look at her skin as a whole, making sure it's warm, dry, there's a good color to it, inspecting everything. We'll palpate her joints up here as we go. And because this is such a large assessment, while you're on one part of the body, so while I'm on here, I will go ahead and assess like skin and her nails, but also we can go ahead and test strengths up here as well. That way you don't feel like you're moving all over the place multiple times. You can kind of do things as a whole. So have you move your elbow out for me. Good. Just feeling the joint. Listening for any pops, cracks, anything like that. Okay, we'll check your hand. You want to note capillary refill. Hers is good. You want to check the nail beds, the skin color, the skin color of the nails, making sure that they're pink, they're not blue or anything, which will be a sign of lack of oxygen. So hers all look good. Her nail shapes are well formed. They're not indented or sunken in anywhere. Skin trigger for dehydration, good. Again, there's not a lot of cracks. Her skin looks okay. It doesn't look dry or dehydrated out. I'll have you lift your arms up and down for me. Okay, and then we'll just do the same thing over here, looking at the skin over here, on the shoulder joint, elbow joint. Okay, we'll do skin over here, good. Nails over here look good, capillary refill, good. Nails are uniform over here. I'll have you move your wrist in a circle for me, both of them. Okay, and then move this arm up and down for me as well. Okay, good. We'll just do your strength, so I'll have you do like a chicken arm, and then don't let me press down. Okay, don't let me pull up. Okay, move your arms this way for me. Don't let me pull your arm, okay? Good. Don't let me push. Good. Okay, don't let me pull. Good. Don't let me push. Good. And then squeeze. Good. I'll have you stand up. We'll do your bottom out really quickly. So basically how we tested shoulders, elbows, wrists, and grip here, we'll do the same. Hip, knees, ankles, and toes. So with your hip, just kind of take it and see if you can swing out and move across. Yep. Good. Okay. Good. Any pain or anything with that? Wiggle your hip. Good. Knees. You're going to lift both your knees up. Okay, can you bend touch your chest? Good. Okay. Ankles, move them around for me. Good. Alright. Lift this foot up. Don't let me keep your heel on the ground. Okay, don't let me press down. Alright, don't let me.
Oh,
now don't
sorry.
let me pull up. Good. Same. Okay. Alright, I'll have you sit down and I'll test you this. Okay. Lift this thing up off the table, please. Don't let me press down. Okay. Okay. With your leg, try to push out. Good. Good. Against, all these strengths are against gravity, so we grade it 0 to 5. 0, no strength at all. 1, a little bit of movement. 2 and 3 is when you get into gravity, so they are able to move a little bit. They can hold it, but it might fall. And then when you get into 4, you have her do this. She's able to hold it up by herself, but whenever I go to press down, she loses this stance, and she can't hold to resistance. 5, which would be full strength, is she holds it up, I press down, and she doesn't move it. So all of her strengths are equal throughout in the upper and the lowers. Looking at the legs, with her legs, she does have edema, probably +2 pitting edema on each side, on her legs here and on her ankles as well. So we could just recommend like a follow-up with the family doctor. Maybe they would want to try to put on some Lasix. Maybe she could just wear some compression socks. I'll have you take your shoe off for a second, and then we'll just test the reflex down there while I'm at it. Okay. All right, lift your foot up, please. All right, you take the blunt end and you just apply pressure. And then,
Tickles.
so her feet are kind of curling in a little bit on this side, which is what we want. If her feet were to fan out like this, that would be a positive Babinski's, which is normal in infants, but is not normal in adults. So that would be an indicator that something is really wrong if we get that fanning out. Put your shoe back on for me. All right, you will do, I'll just stand up for this one. You need to tie your shoe. Alright, so with this one, I'm gonna test your gait.
Okay.
And, so I will have you do you'll take your heel and bring it to your shin. This side, good. Good, okay. Take your finger and touch it to your nose. Okay. That's it. Good. Alright, I'm gonna draw a number on your arm, and then you tell me what it is.
3.
Yes. Alright, close your eyes. I'm gonna hand you an object, and then you tell me what it is.
Mouse.
Yes, good. Okay, and then the next one, I'll just have you stand, so you're good. We'll have her stand for a couple seconds, and then, I'll have you close your eyes and see if you can stand straight.
Okay.
Okay, close. Alright, good. So now we're just testing her balance, making sure nothing's off. Like neurologically, she's able to stand intact, which is good. Alright, you can sit back down. Then we'll do your reflexes and your vision. That part. Ready?
Mm-hmm.
And then the last thing we need to do is your abdominal assessment. I'll have you lean back for me.
Okay.
But if I get it, I'm gonna make sure she's covering. And then with the abdominal assessment, you just wanna feel around. We'll listen to her bowel sounds. We'll go all four quadrants. We'll do right lower, right upper, left lower, and then we'll palpate around for any tenderness on there. with the vowel sounds, you wanna listen for anywhere for 30 seconds to a minute. You wanna see, if you're hearing those sounds in all 4 quadrants, noting, if they're hypoactive, which is not a whole lot of movement, or hyperactive, which you'll hear a lot, crazy sounds going on in there. You should hear something in all 4 quadrants. If you don't, you would wanna notify a provider. You wanna make sure there's no blockage or anything going on in there. So we'll just kind of palpate now around and let you know any pain or discomfort.
Mhm.
I wanna know if the abdomen's soft, rigid, non-distended or distended.
No.
She feels good all around. Again, you'll also just wanna check for any lumps, masses. No umbilical hernias in there that we're feeling.
No, that was repaired.
Okay. Alright, I'll have you set back up for me. And then the one more thing with the eye test, I'll have you look at, I'll have you close one eye and then point to your nose. Okay, other side. Okay, and then I'm going to tell me whenever you see my fingers.
See it?
Okay, and then just goes this way.
Mhm.
Okay.
Yes.
Okay.
Yes.
Okay. All right, and basically, so now we have work from the head all the way down to the toes, covering both sides bilaterally. The only thing with her really that was abnormal is she does have that edema in both of her legs, which again, we would send a family doctor for, make sure she could get treated with medication, and then maybe making sure everything, there's no underlying causes with her heart causing some of that edema. But that's basically how you work systemically from the head to the toe with your paper that kind of lets you write everything down along as you go. Thank you.